Hello guys, and welcome to section 3. This time we're going to be talking about different modes of ventilation used in the intensive care setting in our hospital. We're going to talk about 5 different modes today, and we'll run through a brief definition of each one as well as the clinical indications for each mode. We're also going to include some information on evidence-based studies and current practices and see how that relates to what we're doing. That way you can help physicians choose different modes. When it comes to ventilating patients, the respiratory therapist is the expert, so it's important for us to keep updated on the latest information. We'll start with volume control modes of ventilation, and the first one we'll talk about today is the one that's most commonly used, assist control. The big things to note about this mode is that it is number 1 most commonly used at our hospital, does provide full ventilatory support, and may not be suited for the unsedated patient. Just to kind of review, assist control does have a set tidal volume that is delivered with each breath, a set respiratory rate, an FiO2, as well as a PEEP level. When we initiate mechanical ventilation at our hospital, the doctor will provide these 5 settings. All other settings are left to the therapist's discretion. The reason this mode is most commonly used at our hospital, and actually everywhere, is because it provides full ventilatory support. It gives us a precise way to manage the ventilation of a patient when they're not able to do so themselves. So for this reason, assist control is indicated for all newly intubated patients. It's important to remember that this mode is referred to as full ventilatory support, and it does take over the entire work of breathing. So for that reason, you need to make sure patients are properly sedated to ensure patient-ventilator synchrony. For this reason, assist control is not indicated in the unsedated patient as well as patients who are weaning. The next mode we're going to talk about is SIMV, or Synchronized Intermittent Mandatory Ventilation. We're not going to spend a lot of time on this mode because it's not as commonly used as it once was. In fact, according to studies highlighted in Chest magazine, the poorest weaning outcomes are associated with SIMV. So what you need to know about SIMV is that it is only used for weaning open heart patients at AMC, and that it combines mandatory breaths with patient-supported breaths. Because the mode is built into the open heart ventilator weaning protocol, it is only indicated for those patients and should not be used outside of that. The next mode we're going to talk about is our preferred weaning mode, and that is pressure support and continuous positive airway pressure, or pressure support and CPAP. Important things to note about this mode is that it is only indicated for the spontaneously breathing patient. It provides just a small amount of support for each breath, and it is used to determine readiness for extubation. Again, this mode is mainly used to simulate whether or not a patient will be able to tolerate breathing on their own after extubation. It is also used to exercise the respiratory muscles of those mechanically ventilated patients who are not yet ready for extubation. Remember that this mode of ventilation does not deliver an actual breath, just supports ones that are already being taken, so your patient has to be spontaneously breathing. The next mode we're going to discuss is called VC+, or Volume Control Plus. The important things to know about VC+ is that it allows for a variable flow pattern, and it is primarily used to improve patient-ventilator synchrony. In our previous segment on ventilator graphics, we talked about how we can set the peak flow to meet our patient's inspiratory demand, but that demand changes over the course of ventilation. The advantage to VC+ is that it offers a variable flow pattern that can change according to the patient's inspiratory demand. So in this mode, the flow changes according to the patient's demand. The pressure used to deliver the breath also changes according to resistance and compliance. Because VC+ has the ability to self-adjust according to these changing patient factors, it is indicated for the following types of patients. Patients with acute lung injury, or ARDS, and most commonly for those patients who are asynchronous with the ventilator. The last mode we're going to discuss is pressure control assist control. This mode is used for severe oxygenation issues in patients with ARDS. In conventional volume ventilation, the 2 settings we use to address oxygenation issues in patients are the FiO2 and the PEEP level. When these methods fail in conventional volume ventilation, we need to examine why. Your patient may be going into flash pulmonary edema, or they may be going into ARDS. Pressure control is indicated for the ARDS patient with rising plateau pressures. Pressure ventilation helps recruit and distend collapsed alveoli, therefore improving oxygenation. So for those patients with severe oxygenation issues that don't respond to PEEP or FiO2 in volume ventilation, think pressure control. That concludes our section on modes of ventilation. Click the link below and take the test.